A 55-year-old male presents to the ED with shortness of breath. On examination, he is in significant respiratory distress. His respiratory rate is 45 breaths per minute, saturation is 85% on room air and has bilateral reduced breath sounds, prolonged expiration and rhonchi. He was treated with back-to-back nebulizations with salbutamol and ipratropium bromide and was also commenced on BiPAP. During the initial 2 hours of treatment he showed improvement. Yet, he gradually started to deteriorate. He became more tachypneic and his distress increased. What could have caused this deterioration? Could it have been due to inadequate bronchodilator treatment? On re-examination, he was in moderate respiratory distress. The trachea was central. There was no air entry on the right side of his chest. What could be the cause of these findings? A bedside lung ultrasound was performed. This was the right upper zone. This was the lower zone of his right lung. What can you see? There is absent lung sliding despite obvious efforts to breathe. There are A lines. A lung point could not be identified. What could be the cause? Could it be a pneumothorax? Yes, it could. But it could also be absent lung sliding due to bullous lung disease, as this is a COPD patient. As his vitals were stable, trachea was central and his IVC was collapsing, there was no evidence of a tension pneumothorax clinically. Therefore, it was decided to take a chest X-ray to make sure it was a pneumothorax rather than bullous lung disease, prior to insertion of a chest drain. This was his chest X-ray. What can you see? The trachea is central. Let's take a closer look at the right lung field. The lateral border of the right lung does not reach the lateral margin of the thorax. In other words, the right lung is collapsed and there is a pneumothorax. However, there is no deviation of mediastinal structures to the left to suggest a tension pneumothorax. A chest drain was inserted and the pneumothorax was decompressed. His saturation improved to 100% on room air and his respiratory distress was relieved. This was his post-procedure chest X-ray.